thank you all for joining us. This is the April 2026 meeting of the Community Health Advisory Council. My name is Katie Plum and I chair CHAC, affectionately known. The Community Health Advisory Council is established in Oregon law and instituted locally in Clark County. CHAC provides recommendations to the Clark County Board of Commissioners regarding public health and behavioral health in the community. These meetings are an important opportunity for partners in the community to work collaboratively to support the health and safety of Clark County. Please note that this is a public meeting. There is a designated time today in the agenda for public comment related to the agenda items. If you're a member of the media or general public and have questions or comment that does not relate to today's agenda, we ask that you reach out directly to a CHAC member or staff outside of this meeting. We'll begin today with a member roll call. When you're called, please show your name, role, and organization if applicable. After roll call, we'll invite staff to introduce themselves as well. Well, I'm gonna have to designate or delegate roll call to someone because I end up having way too many. I'm so sorry. Alex, do you happen to have?
I do.
Would you do roll for us? That would be
Yes, I can.
You're juggling a few things.
Yes. All right, Katie,
I'm here.
April.
Yeah.
Hold on. Now I got to do this slowly.
Mm.
Emily.
I am here.
Awesome. Grant.
Yes.
Thank you. Courtney.
I'm here.
Thank you. Erica. Hope.
Here.
Bill. Kimberly.
Yeah, this is Kimberly, Chief Nursing Officer for St. Charles. Here.
Thank you, Kimberly. Liddell. Audra.
Here.
And last but not least, Devin.
I'm here.
Thank you.
Thank you all. Alex, thank you.
Yep.
Kudos. That probably works much better than me doing it and having to navigate the screen. Let's we'll go around the room. Dear goodness. Maybe I should not be the one who's told you this today. I think it's allergies. Yeah, the stuff in the air. Let's go around the room to start. We'll do introductions and then we'll go online. Angela, do you want to start us out?
Angela Cumming, Program Director for Best Care. We do have snacks over here if anybody would like snacks.
Katie Plum, I'm the Health and Human Services Director for Clark County and Chair of this group.
April Plum, Primal Mosaic.
Rita Roden, Perinatal Care, Clark County Health Department.
Shauna Holland, OSU Extension Family and Community Health Program Coordinator. I'm Shelby Fisher, Clark County Health and Human Services, Prevention and Promotion.
Is it my turn? I'm Alex Greenberg, also Clark County Health and Human Services Prevention and Promotion.
Audra Over, Public Citizen.
Hope Porterfield, owner and therapist at M3 Alliance.
Let's run through online. I see.
I'm just gonna unmute you guys and go as I unmute you.
Courtney Peressa, community member and outpatient physical therapist at St. Charles in Prineville.
Thank you, Courtney.
Devin next.
Hi, Devin Nelson Harmon, Program and Community Manager at NAMI Central Oregon.
Thank you, Devin.
Emily.
Emily Jerome, Mental Health Officer at Prineville Police Department.
Kimberly.
Yeah, Kimberly Munn, Chief Nursing Officer at St. Charles.
Thank you, Kimberly.
Grant.
Grant Haval, Special Ed Director for Crook County School District.
Hi, Mike Case, IDD Program Manager with Best Care.
Nope.
Hi, everyone. I'm Riley Martin, Crook County Health and Human Services Prevention and Health Promotion Team.
Excellent. Thank you
Oops,
all,
sorry,
and
Riley.
welcome again. Oh, sorry, Alex.
Nope, I accidentally hit a button again, Riley.
Oh.
You're good. Yeah.
Okay, first on our agenda are appointed member announcements. If there's anyone that has something that you want the group to know and you do not have designated time for your organizational agenda, now is your time.
Well, I did went to explore 301 with this meeting, and then somebody said, I'm just shocked that nobody knows, that people don't know about this. I didn't know about this. One of the glitches that I hit on Primeville, and it took me to Muskogee, Oklahoma, which I reported, and they think that they'll fix it.
Well, thank you for doing that. Anyone else? All right, any staff announcements from either Best Care or Public Health?
I can go ahead and announce it. Public Health is Public Health Week, so we'll be doing some little things online, and then we'll be having the perk on Friday at the Mosaic Health Department building in the conference room, going north to the left. So join us there at church if you'd like. I'll have some little snacks.
When you say online, that's our Facebook and Instagram accounts, correct?
Yes, correct.
Please like and follow. Go ahead, Riley.
I just wanted to put it out there that this weekend, April 11th, from 10 a.m. to 12 p.m. in the Wilco parking lot, there's going to be a wildfire preparedness fair. A bunch of community partners are going to be there doing demonstrations, having some giveaway items and other educational materials. And we'd love if you could spread the word and show up to get prepared for this upcoming fire season.
Thank you, Riley. Any other hands? Either online or in the room? So we have some time carved out for Best Care. If there's anything that you want to share with the group, or
I mean, I don't really have anything. The only thing, and I'll be talking about it at the commissioner meeting on Wednesday, is that we're still in contract negotiations with Pacific Source, which aren't going well. And so we still have not signed, Deschutes County still has not signed. They're actually going to mediation with OHA. So I think that we're holding off on our next proposal until we kind of see how their mediation goes, because we're trying to kind of do things in solidarity with them. My understanding is that Pacific Source is also the CCO halftime for the Gorge, and they still have not signed either. So anyway, not going very well. They're proposing cuts just across the board. So a lot of what they are proposing ultimately will mean that there will be some programs that are going to have to be closed down if we do have to go that route. So the current contract isn't up to the end of the fiscal year, so we still have until June. But it's been not a very friendly process, I guess. I have more of a spiel that I'll give. I'm not in the contract negotiations, so I'm kind of getting this third party from our CEO and our CBHO. But that's my understanding. But I do know that DCBH is going to mediation because they're unhappy. So that's our biggest date, I guess.
kind of a big deal.
Yeah.
So for an in-depth presentation on that, you'll be at the Board of Commissioners meeting Wednesday. Correct.
Yeah, but I wouldn't say necessarily like an in-depth, I have a thing to read that's more, that's more kind of specifics about the steps that Rick and Melissa have been going through and what the next step is. But yeah, I'll be there on Wednesday. I'm assuming I haven't gotten confirmation, but I put in the agenda item.
All right, we have some time carved out for public comment related to any of our agenda items. So if you are not an appointed member and would like to provide any comments about the agenda, and for folks, if you don't have it in front of you, the bulk of our agenda today is going to be focused on the work plan for the Community Health Advisory Council that we are hoping to make official. Pass these out. For folks in the room, there are hard copies. And those went out with the agenda.
Yes.
Thank you.
It's front and back, just so y'all know. I didn't just cut it off in the middle. You're welcome. You're welcome.
Okay, I do not see anything in the chat for public comment, Alex.
Not that I am seeing.
Okay, and I don't see virtual hands raised. Physical hands raised in the room. All right, we will dive into our next agenda item, which is some level setting. I just want to give an overview of what we've been up to leading up to this point and leading up to the draft work plan that was sent out and that some of you see in front of you. We've held 3 special sessions, and for public meeting speak, that means that they aren't our regularly scheduled bi-monthly meeting like this is. We added these to the calendar in order to pull together both appointed members of CHAC as well as members of the community and additional partners, because we wanted as much input as possible into our planning process and in order to get this draft work plan in front of you all today. Several of you were part of that process. When you could be, thank you for your time and input, because it was 3 additional meetings to our regularly scheduled programming. In our first session, we talked there a basic foundational vision and mission statement, and we will have a draft of those to bring forward. I want to confirm, Alex, do we have quorum for any voting?
1, 2, 3, 4, 5, 6, 7, 8, 9. Yeah.
That sounds like quorum. Awesome.
Yeah.
We will be able to vote here after we do some review of these, but vision and mission are 2 of those foundational pieces that we haven't had for this group before. They're drafted. We'll present them to you today. Session 2, well, a little bit of one. Session 2, we did a whole lot of research into assessments and plans that already exist, specifically for Cook County and also for Central Oregon. And in going through that, we were looking for gaps, ways that we could partner and align and make sure that we're not doing something that's already being done or we're counteracting some efforts. We wanted to have awareness of what is already happening or being planned to happen in our community around these topics. Health is one, a subject that gets brought up in all different kinds of places. It doesn't even have to be a health specific meeting when we sit down and we talk about issues that are related to health. There's things like transportation and housing and some of those social pieces that come up in a lot of different spaces. So we try to keep that in mind in this planning process. We drafted some topic areas we had a wall full of topics that we know are needs in Kirk County based on data, based on our experiences as professionals and community members. And we whittled those down to 3 topic areas that we'll present to you again for consideration for adoption. Once we had those 3 topic areas, we did even more work to decide and look at what do we actually have the ability to influence in our roles as members of the Community Health Advisory Council, and what is the role of the CHAC in furthering this work. Those were our special sessions. For those of you who were there, is there anything that I missed that you want to highlight? And so for folks online, again, you'll have to raise your hand in order for Alex to have you be able to come off mute, or you can put comments in the chat as well, and we'll get those relayed through the room. That was the quickest summary ever of a lot of work. I recognize a whole lot of work went into those 3 sessions and all the background research that was done as well. Okay. So let's dive into the review. Alex, I don't know if you can maybe copy and paste this into the chat, but we have a drafted vision for you all to share. Oh, yeah, great. So for those of us who are visual processors, I'll also read it for those of you, bless you, who can process information verbally, because I cannot, I have to see it. But we'll get that pulled up here in just a moment.
Sorry, my computer's being slow.
I'm impressed that we've had technology going so well for us today. So a little bit of slow, I think is tolerable. We can do that.
Sorry,
everyone. I'm getting it displayed, at least for folks who are online. I'm gonna put it.
Kidding me?
I'm just gonna copy it into the chat.
Thank you. I can't even get anything to load. There we go.
Okay. Draft vision, went into the chat, and I don't think, we don't have any hard copies of the vision, do we, Alex?
No, I did not bring those today. I'm sorry.
Okay, well, I will read it until we get it up on the screen. Our vision, our proposed vision, is a healthy, connected community where all people in Kirk County have fair access to coordinated, high-quality supports, basic needs, and lifelong opportunities to achieve mental, physical, and emotional well-being.
This is not updated one.
That was a product of a lot of wordsmithing. It's still a lot. It is a lot of words for a vision. And I'm going to put the mission in the chat as well, partly because there is some overlap in language in the vision and mission that is necessary, but there's also, I think, purpose in that too. So we've got a couple thumbs up anyways for a vision. I'm gonna put our mission in the chat as well.
I don't know why, but I don't have the ones that we redid on my SharePoint, Katie. I don't know.
They're in the, so in SharePoint, you had a beautiful recap.
I know I did, and I'm not finding it. Like, what did I do? It might be. You might be able to since you're a co-host. You can try.
Looking promising.
There we go. Yeah, I don't know where I put that on my end.
So I know it's even kind of rough to see in the room or something, but let me see if I can make it bigger for it. I'm sitting ways away, so
You might have to make it a little smaller.
you all are. So, oops, sorry. I'm so patient. It's getting worse.
Oh.
Yeah, yeah. Whew. I mean, I can't read this thing in front of me without my glasses. I can read that.
It doesn't look as many words as it sounds. The vision
The
statement.
vision, yeah.
Yeah, reading it makes it seem a lot wordy.
Okay. For our auditory folks, or folks that it's instructors. I guess I can mostly read. I just have to really concentrate what's on the screen. Draft mission statement is that the Kirk County Community Health Advisory Council unites community member and partner voices to identify and prioritize local needs, shape collaborative solutions across sectors, and provide informed recommendations to the Board of Commissioners that advance holistic, prevention-focused solutions so people across the lifespan in Kirk County can access basic needs, responsive supports, and opportunities to thrive.
Also, hello, Erica.
Welcome, Erica. I thought Stephanie popped in too, yes?
Yes, Stephanie is also here.
So I think the ask is, would you like us to dive into these? Do any other wordsmithing? Is that something that we can do in this space? Is it something that you want us to,
I'm trying to find where she's talking about.
Last one. Across the last one, should be there.
Across the lifespan, it should be their lifespan. Got it.
Oh,
Yes.
I'm sorry, I did not know where that conversation was coming from.
Yeah.
It was in the chat. Thank you,
Yes.
Devin, for your feedback.
Once I find the document, I will go in and fix it.
So, we can make that change, Devin, and if there are other changes that you want us to make on the spot, we can absolutely do that. If you think it's perfect, we could, well, I would entertain a motion, to approve with changes, to whatever else you want us to do with this. It could be a motion to scrap it and start over. No, we won't. But that is the question on the table.
Is that for your board only, or like? We're just
This-
listening at this point, correct?
Yes.
Okay.
So, yeah, this is put forward to our appointed members for
Okay.
consideration. I
Oh,
don't know where or how someone read through, like, the red line, and I don't know how to interpret that.
did I do that?
Did that just happen?
Yeah. I thought I turned off whiteboard and everything, so I don't know. Stephanie.
I'm sorry, it was me. I'm driving and I was trying to put something in the chat and it made a red line.
Well, please continue driving, don't worry about.
Yeah, we'll leave it.
I'm so sorry.
You're good.
this point, we're at a decision-making point for the group. So if you are an appointed member, it looks like we have a motion to approve in the chat by, is that Devin?
It was a question. I think she's asking if she's,
Okay, motion to approve question mark.
Yes.
Yes, if someone would like to,
I make a motion to approve the vision statement and mission statement. Can we do both of them at the same time? Yeah.
why not?
with the one change that Devin,
What the one change that Devin
Okay.
said.
Okay, we will need a second to that.
Emily seconded.
Thank you, Ellen.
Okay, now I gotta do my thing again. Can you unshare your screen so I can get yays easily? Okay, now I'm gonna go through and ask yay or nay for all members. Katie?
Well, I think if you are online, you have an option to put it in the chat and we will,
Okay.
read that out at the end.
Okay.
So in the room, if you would like to approve or vote yes on that motion to approve, you can raise your hand. We've got April,
Okay,
Audra, Belle, and Hope in the room. And the folks online, you can vote in the chat. Yay, Courtney. Any other yays online?
Devin,
Devin.
Kimberly,
There we go.
Erica. I still need to hear from Grant and
They
Emily.
might not be a yay. So,
Yeah, well, you can say nay. I just need a
Yes.
response. And Grant is the last member.
would like to abstain or not approve that motion.
Yep.
We just need to hear from everybody that's appointed. It does look like, I mean, we have,
Even
the
without,
majority.
yeah, even without Grant.
Okay.
Maybe he
We
might have had to
can-
step away or something. Yeah,
we can mark that as abstain.
okay.
In a moment, okay. So we have a vision and a mission. Congratulations. Next up is to review the topic areas. So I mentioned we had a whiteboard full of topic areas that were then categorized together to come up with three kind of focus areas. And those three focus areas, if you look at the draft work plan, is the far left corner under the goal column. The first of those focus areas is social drivers or social drivers for health. The buzz language or commonly accepted language is a social determinant of health. I don't agree with that language because I don't think that it is not a finite definitive thing. If you do not have as much fiscal resources, it doesn't say you're going to not live as long as others. It is a driver though, and research does say you don't have as many resources or have some of these social aspects in your life that it does affect our health. So the social driver of health, for social drivers, we had a lot of conversation about things like transportation, housing, access to food, daycare, work, job opportunities, and how all of these things affect our ability to either obtain health care or care for our own health and our individual behaviors. So that is one of the focus areas that is being proposed as being addressed in our work plan. The second one is access to care. And specifically, well, access to health related. And then we have a focus area of prevention and recovery. So activities, resources that contribute to the prevention of addiction. We spent a lot of time talking about preventing addiction, also preventing chronic illness as well. Those things that we can prevent, what does that prevention look like? And then in the recovery space, we have treatment that gets spoken to in that access to care piece. So we were in this focus area wanting to make sure that we had the full spectrum of services in our community, from prevention, treatment, and recovery. So between these three focus areas, we have that. I'm wondering if there's feedback to this, if there's so much detail that went into the compilation of these and landing on these three. And so I'm wondering if there's anything that you all think is missing that doesn't land in one of these focus areas, if you want to highlight that and maybe the group can speak to it. Or again, if these look like perfection, we can vote to adopt them as part of our work plan. You can also tell us to scrap it and go back to the drawing board. And anything we can.
And is everyone online able to find it with the meeting note agenda and public notice that was sent out? Or one of us can share it, yeah.
I will note that as part of this discussion, we had 4 focus areas for a while. And that 4th one was around community readiness to do this work. And the discussion around that and why it was decided to bring as a recommendation to this group that we not include that is because it is part of the other 3. So if we're going to work on social drivers of health, we'll have to have community readiness to do so. Same with access to care and prevention and recovery work. Got that in the chat so folks can read and see those topic areas. And then for context, I know people in the room can see how this kind of builds on each one. If those are adopted as focus areas, we then have some objectives that we'd like to propose to the group and some activities that would move us towards addressing needs in each of these focus areas. I'm gonna ask is if those 3 are accurate, again, I'd entertain a motion. They did not, motion for that as well. Or any discussion?
Did it work? Is my screen being shared, Katie?
The work plan, a corner of the work plan is being shared, yes.
Okay.
At least that I can see.
Perfect. I'm trying to make it smaller. What part am I supposed to be showing them right now?
Well, all we need to do right now is decide if those are the 3 focus areas the group wants to address.
Okay. And are we wanting to vote on that?
Sounds good to me, but I don't think I get to. Nope. Okay. So if you're gonna appoint a member, you can put forward a motion.
I make a motion that we vote to approve the 3 goals, 3 areas of the goals.
Okay, so we have 3 focus areas. A motion to approve those 3 focus areas. Is there a second?
I second.
Thank you, April. In the room, appointed members, if you would like to move forward with these 3 focus areas in our work plan, raise your hand. Online, if you can put in the chat we had, 4 folks online, myself, Katie, Hope, Audra, and April, all wrote in the keyboard.
Kimberly, Devin, Emily, Grant. I think we're waiting for Erica. But we heard from Grant and Emily and Devin and Courtney and Kimberly. So we're good.
Right. Approval. If there's anyone who, I know in the room we don't, but anyone online, if you would like to abstain or.
They all said yes
no?
or yay.
Okay, unanimous, awesome. I wanted to ask that we at least land on our topic areas, because when we start diving into objectives and activities, those are much more detailed and in the weeds, and we might not get to a space of approving those today. So what I'd like to do today, that we can dig into, is there are a couple what are called SMART objectives in the work plan. And those are pretty targeted. We want to, by a certain date, do a certain something that moves the dial on each of our focus areas. So, Alex, I know you can't, for some reason, we're not able to see the, so what I can see,
I might be able.
screen, it might also be easier for me to share that.
Yeah, you can share if you want. That is a-okay. Okay, it's all you.
I'm gonna lean on folks that worked on these. Let's look at the social driver focus area. And for folks that were part of the work session to kind of hash through what can we do about social drivers of health in this space? Is there anyone who would be willing to speak to that process and how we landed on objectives? And that can also be staff or community members who were present in that discussion as well.
You can talk if you want. Yeah, you're allowed to talk now, Shauna.
I don't see the voting piece that.
Well, my thoughts, and what pushed me to look at the 211 and just sort of, well, that first meeting coming up, I feel like I should, but on the Nextdoor app, someone was looking for housing assistance and did, you know, and they didn't get much response. So I'm wondering if there's some way we can get awareness of that avenue out in those areas for people to think of. That's all I got.
Thank you all. I'm almost going to share.
Absolutely. I mean, it's still kind of, you want for the social drivers, I think too, like getting all these online resources is wonderful. It was nice and graphic, I think that's only available online, so, having those same resources in paper form and, you know, different things that they can access the same information as social population or anything that will help there. Because my chart is very inaccessible to that demographic, online resources in general, using the websites to find things, so I personally think that community health workers
out and engaging with that demographic, it would be much more serving than updating our websites and updating how to get on my chart. They're a lot, a large percentage are not.
But part of the discussion that we had around social drivers was that there are resources here. We talked a lot about how there aren't enough resources, and we had really dove into what are we lacking, what is or isn't working. And then when we got to the point of like, well, what can we do as this group? We felt like, or a lot of the folks in the room felt like our best option is to be able to make folks aware of what does currently exist, because that is part of the problem. There are things that exist. There are actually a lot of things that exist, but it's challenging for people to know what they are. If they're not in these loops and in these meetings, it definitely isn't as well known. Even if they put it out into the interwebs, folks that reply with those things, there isn't the community knowledge to even share it through those platforms. So there was a lot of discussion of like, how do we increase awareness? And when we looked at, so 211 came up as an online or phone, you can call 211 and access these resources if they will point you in the right direction. And if there is something that we can do to monitor that, and Audra's already done it by us as professionals in the community and working in this space. We can call and we can troubleshoot and make sure that those tools are working correctly. But really where we figured we can make the most movement is increasing awareness. That's what we think there was talk about, there are multiple entities working on this particular issue, right? And there are ideas around the development of a resource map. And I'm not familiar with the resource map concept, but I'm wondering if there's someone in the room who can share that out, because that is a proposed objective that we partner with that effort and contribute to that being an option that we can share out, and at least through that tool make people aware of resources that are available. Is there somebody in the room that's more familiar with that? Yes, it is a COHC, Central Oregon Health Council and Central Oregon Community College effort.
Yes, I did go to that meeting on the mapping. Essentially, I think Devin did too as well, and they kind of just did like a mock-up model of Central Oregon, and everybody was deciding like what map. I think we followed some models like in Montana, and we were looking to see what model that would work best for Central Oregon. I do have a example of that. I think I sent it to you for your class.
I think Devin had sent it in
Or
one of
maybe
our
Devin.
previous meetings
Yeah.
as well, and I had pulled it up after the meeting. And I mean, it essentially kind of like when you're on Google and you
Yeah, it
Google a
looks like
business or
Google.
an address and it pulls up that separate window and a map, and then it tells you about the business. It was kind of like that, but it was very minimal, and there were only like 3 resources for Crook County. And I mentioned that to Devin, I think at a different thing unrelated to CHAC, and she said it's kind of
It's
just like a
mock-up.
prototype right
Yeah.
now. It's not any, but that's kind of what their idea was, I think. And Devin, please correct me if I'm wrong on any of this. I can unmute you if you want. So that was, I think, kind of the idea, but people like us from all 3 counties would help COCC and COHC give this information, and then they would have this map. I don't know if it's like a website or something Yeah, so we can submit resources to them that they add. And then it's like a website where we can share that with anyone. And they can go to this website to find all these different resources within each county.
I agree, though, that not everybody has access to the online,
Mhm.
so this can be in paper form,
Mhm.
like, put it in food boxes or, handouts wherever, at the library and Mosaic and.
Yep.
But there's definitely more than 3 in Cook County. I mean, we have a whole resource binder that our case manager.
Oh, they were just using a mock-up that day, like essentially what we did is they had this whole room. We had these big white sheets of paper, we worked in small groups to develop the type of map we liked. Resources, they hung it on the wall, then they just did this mock-up as an idea.
And
So
then
it's real small stages right now.
Yeah.
Okay.
And Devin did ask, so like a quarterly catalog type thing. And I think especially after going over the community needs assessment from St. Charles that was focused in Crook County, like most people with a high school degree or lower and the senior citizen population don't utilize online as their options, and not all of them have access to internet at all times. So like Stephanie and I had talked about having something on our, even like the county website, similar to what COCC and COHC are doing, but then also being able to print it off in a version, kind of like what Shauna does through OSU Extension every month or every 3 months, where it's like a calendar and you can choose, do you want to see everything? Do you just want food insecurity resources? Do you just want housing resources? Do you want mental health resources? And you can kind of go through and choose what category you want. And then you're able, and we could all have access to that to print out to give to people. Again, that's huge scale. That was just Stephanie and I's conversation that we had talked about.
And Neighbor Impact does resource mapping really well in their website, so they have it for the services they're aware of. I don't know if we're like reinventing the wheel, but I do think there's a lot of local things in Burke County that are not on there. And it's sort of things that because you live here and you have a connection with so and so and but if you go to Neighbor Impact's website, it says resource mapping and they have it and you pick what do you need, food, housing, Head Start, Happy Bills. And
So
it shows a resource map.
I know we're still kind of talking about the objective, and this is a very large scale objective, but we're getting into the nitty gritty because we all like to problem solve. But if you look at the activities section, the first part of this would be for certain people within this group and this council to look at inventory and gap mapping that already exists, right? We're not trying to build something from scratch if we don't have to. If there's stuff that already exists, how can we utilize that to make our jobs easier? But we just want to try to do something where people from every entity in this room, law enforcement, every group can go to the same place where we all know we're submitting our information and our resources, and then share that out with anyone we may be working with. So it's not like Shauna knows of these 5 resources and Hope knows of these 2 resources, but there's no overlap and there's things being lost in translation.
And I like the idea of the quarterly catalog though too, because what if it's not somebody any of us are talking to? What if it's somebody just looking for resources? And I think about like the roundup and how useful that is. Like people just know you go get it wherever. So if we're printing something quarterly and putting it in places like where the roundup is, we'll probably hit a good demographic that way too.
Well, with the roundup, do a courtesy print of that information in the publication?
That's a good question. I know that sometimes they do like all the different groups and meetings that happen every month but yeah, would be a good.
There's a lot of channels.
Yes.
Yeah.
So these are all part of the activities that exist within this SMART objective. The SMART objective is kind of more of like a goal. How are we going to get there? And it doesn't have to be partnering with COHC to develop this. That just came from our last meeting, and I think Devin and Rita might have been in the same group and talking about what they're already working on. So trying not to reinvent the wheel.
I'm gonna throw something out there up here. based on how this discussion is going. I think we should keep having this discussion, and are we taking notes? This is recorded, so we'll be able to take notes and come back. But when we get to a point of, I will ask you all to approve this draft work plan. What I'll say as a caveat, as we're having this discussion, is that this work plan, if we adopt it, is a live work plan. So it will be, as we have these discussions and we start doing this work, we can change it. We can add a goal, we can add an activity, we can change one. If we realize that this whole mapping project loses funding and everybody will be working on it, moved out of the area and it's not possible to do, we can do something else. So we won't be locked into these exact things as we do the work and amend and change as we go without a big production. What we'll be looking at adopting today is the bones of it and giving the group permission to move forward, giving staff time for organizations that are staffed to already do some of this work. It gives us the green light to coordinate with them, start moving ahead, and then coming back to this group, asking for help, asking for input as we go over the next couple of years. So hopefully, are there questions about what the purpose of what we're looking at here, how we're going to use it? Because we're going to get into problem solving mode as you know, when this is adopted. We're also going to get into, like Audra mentioned, how do we pay for it? Is someone going to do this for us for free? Who's going to staff it? Who is responsible for printing off this thing every month or quarterly? And those are the things that if you give us the green light to move forward with this work, those are the things that we're going to work through either in these regular meetings or in work group meetings. A lot of us are in other spaces where these conversations are happening. So the purpose of CHAC is, and I'm trying to look back at the mission we just adopted. It's a convening space. It's a coordination space so that the conversations that are happening in all these different places come here. And then there's a discussion of if there are overlap, are we recreating the wheel? Who's doing what, where, and when? Is there more discussion that you all want to have on the social drivers piece? Are we off? Are we completely off base anywhere? You want to see something added or moved? I think what stands out to me in this discussion is that piece about we can't rely on internet technology. Like we have to make sure that all demographics in the county have access to this information and that we're making sure that it's available in a variety of ways.
But some of it I think is relational too, like I feel like we're a very relational county. So this kind of something online isn't necessarily approachable. I like this. That was a lot of information. I only got to go to the one extra worker, but I'm impressed. It's like it was a lot of information to put into one little space in a concise way. So it's pretty cool. Kudos.
I've scrolled down to our access to care focus area.
There is one more SMART objective in access to care, just so you know. If you want to
Oh, okay.
let them read.
Yeah.
Yeah.
Here's the first two. I'll highlight again in this discussion that there was a whole lot of dialogue about what we're missing and what we don't have. Specialty care came up repeatedly. Why people are or are not able to access care. And so when we're setting goals, the conversation really went towards, well, what can we control in this space? And it came back to awareness of what does or doesn't exist. and making sure that that information is available. And for what does exist, that people know how to use it, how to access it, and how to effectively use it. Maybe that's insurance navigation, that maybe it's, I'm gonna lean on the folks that were maybe really deep in this conversation in the work groups. If there's anything that you want to share about the access to care piece and why we lean towards that information sharing again. Community knowledge and awareness, how to navigate, a lot of that was built into this. How do we make sure that people have access to care they need? That's the group that for the deep dive into this work.
I have very messy notes around it. One thing we wrote is just have more seamless access when working with community partners. To reduce the barriers. Which seems like sometimes when you're referring somebody, it's like you're not getting to close the whole loop on that situation, like sending them to Thrive. And then they don't make it, maybe they don't make the cut of the 6 or 7 people they see, and then starting that over again, and just how do we like continue to capture that?
And I
Those
think
people back.
Go for it, Rita.
Back around.
And I think that's what the first objective in there is kind of about, is implementing coordinated systems for sharing healthcare information so that there was shared messaging, better referral pathways to know that like if Angela and Hope both referred someone to Mosaic, but now Hope can look and see that Angela already did it, so Hope doesn't need to. Stuff like that.
A lot of this work is for both providers and like community health workers and folks that are helping other people navigate this and know what and how to access and capturing that.
As well as, I think the third objective is more around how we talked about the lack of specialty care in all sorts of realms. So it's instead of trying to create positions that we know we can't sustain in Crook County, working with partners we already have, like St. Charles, like OHSU, where we know they already do this in places like Burns that are even further out, but always assuming that because Crook County is close to Bend, that it's easy, but not realizing being here that most of our county doesn't always have the means to get to Bend. So is there a way we can have specialty providers come in 1 day a week, a few days a month to have treatment here so that people don't have to go further? So
advocacy.
That's fun. Yeah. So it's not only access to care in terms of better communication within everyone who may be working with one person, but also how can we better serve people in Crook County that aren't getting the care they need or aren't able to access it conveniently because of transportation, money, family, whatever it may be.
That is a strength of this particular body, is that we're appointed by the commissioners to do this work. And so if we identify a need and a solution, we have the ability to get our elected officials behind that and advocating for that in their spaces as well. And sometimes it just takes us increasing their awareness about issues for them to be able to speak to it, and they have the ability to do at least more than myself and my team as public employees. There's only so much that we can do, but when it gets to our elected officials and some of our other partners, they're able to advocate in ways that maybe a lot of us can't. All right, I'm gonna take a look at the prevention and recovery goals. A lot of this is around awareness, coordinated awareness building, I guess. Having our folks work with other partners who are doing prevention and recovery work so that there's, again, a space and a lot of overlap in these, so that there's a space where people can go to find resources related to prevention and recovery and know how to access it. There was a need about just activities, events, places that people can go, things that people can do that are recovery friendly. And so that is one that's it's a little bit different than our other goals, where our other goals were what exists and how do we make sure that what exists people are aware of. This one is, we identified a gap in this, and so how do we support events, activities, spaces that are both prevention and recovery friendly. Seth. Oh, sorry, Alex, you have to.
Yes, hold on, Stephanie. I'm coming for you.
Sorry, my chat function's not working, but to add to that, I think more than just support those in recovery and be recovery friendly. I mean, I think a lot of people would like to have spaces where alcohol is not present, regardless of whether they're in recovery or not too. So I just want to also highlight that just could be like a prevention effort in itself, is to just have spaces where alcohol is not present.
When we look through these goals and potential activities, is there anything that we're missing? Anything that's not necessary?
I have a question. How closely are we in Cook County working with the innovator agent from the I don't know how they funnel down into serving our community, but how engaged are they in this and what we're lacking? Do they know?
Who was it,
Advocating
Shauna?
for us?
It's fairly limited. Our connection with that individual is largely through the Central Oregon Health Council, and we have the elected official, Commissioner Harmarack is on the board there, and so that's our direct connection with that person and with this body of work. So that's a good question. It segues into what would happen next with this is we would take it to the Board of Commissioners for their blessing to move forward with this work. And so that's twofold. One, it makes them aware of these things, and it's by them saying go forth, I think our ask will be that they help us and support us in this work too. So that would be one avenue I think that we could advocate for more of.
And what group did you say, Shauna?
The innovator agent, I don't know enough about it. I know enough, very basic, but it sounds like that is someone that should be really aware of where we're falling short in Cook County, where our needs are.
I think they rely on that Central Oregon Health Council space. Yeah, and so that's on other folks. So our Commissioner Harmarack and others who attend those board meetings to advocate for county specific needs, so that it doesn't get lost in the Central Oregon bubble.
So they're supposed to take our needs back to the
health organization that's serving us, correct, which would be Pacific Shores, and tell Pacific Shores, hey, you're not leaving these meetings in this region.
Correct. Or how can we work together to address them?
Yeah.
Their capacity to do so is very limited right now, not the same resource that it has been in the past.
But Commissioner Herrick would be our direct communication with that person. It's not at the local level.
Then
We could reach out and call them. Yeah, but that's the primary space right now. So that could be something that we explore. How do we get them, that person, additional contacts directly here? I don't think that it necessarily has to only go through that space.
Okay.
Yeah.
Courtney also asked, do we want our prevention and recovery work to be solely focused on substance use or also chronic disease? If the latter, we may need to update some language. Any members online or in here have any thoughts?
Or our staff and folks can speak to this.
So I remember that was a good point. It's a big point about how large of that net can be cast then and how much what we have, or do we just bite it off and see what we can do?
I feel like in our work on the prevention and promotion team, even though we focus on substance use, I think chronic disease is kind of built into it because there is a lot of chronic disease that can come from stuff like that. And the prevention aspect of being healthy and being, for my mental health side of things, all the things you do for your mental health can help prevent chronic disease. I don't know if maybe including both of them at once specifically would be too much to take on, or if we want to try. I think it's up to the group as a whole though. And both, let's see, what did Kimberly just said? Prevention for chronic disease is needed. And Emily said, I agree with Courtney, it should be more generalized.
Because generalized would be good, but how do you generalize it without and staying a little specific? Because just like Stephanie said, it would also be probably nice for families or there's other people that want events that are not substance related. Yes, yeah. So how do you, like, if you make it just health focused community activities or not health focused, but I don't know how you word it.
The beauty is that substance use prevention, addiction is a chronic disease. And so a lot of the same interventions that prevent one thing, like
that's where I'm saying
they are also preventative of other chronic diseases and addiction. Reduction in alcohol consumption is a huge cancer prevention and a very effective cancer prevention intervention or strategy. So I think it would be very realistic to generalize this a bit while staying true to some of the intent specifically around substances, but broaden it a bit to include other chronic diseases. Diabetes is one where some recent health data came out in the last year that Crook County's rate of uncontrolled diabetes is the highest in Central Oregon. And so that could be something that, we put some effort behind. There's already organizations putting effort into that and having these conversations, but I think it's worth us being part of those discussions.
Well, and reading over this, even though we've primarily been talking about it in terms of prevention and recovery of substances, it's not like anything in here except for maybe the list of including AA and NA and recovery support groups. Other than that, we get to decide what prevention and recovery mean in this group. It can be prevention of both chronic disease and substances. even though it doesn't specify it in here, as a group, we can know that's what it means. And maybe in the focus area, we specify that it's for both. But in the objectives and activities, it can encompass all of that. It can be, the partners can be both AA and NA, it can be St. Charles, it can be Mosaic, it can be Crook County on the Move. Cause I know they do events for cancer prevention and stuff like that, so.
When you guys were having the implementation of making this, was when this objective came for, or this goal, were you guys like, we need more resources for recovery, or was this like, we need more healthy resources?
Both.
Yeah, as well.
Okay, so I think you could just maybe even take out the recovery word and say like prevention. Resources, health focus, you know. But if you're really focusing on just recovery, it's gonna be.
There, conversation in the chat, Alex, but there.
Not since the last I read. Does anyone have anything to chime in after all that?
I think the main point when we were discussing this was also just increasing activities that are alcohol free, just in general, like to the general public.
Yeah. Well, and like I think even Liddell mentioned a few things about like for her family and her son is going into spaces and events in town where there is more alcohol and stuff, it can be overwhelming and too much for her child. So having more family friendly, substance free events, not even just for people in prevention and recovery realm, but just for families that are looking to engage in that where it's more comfortable for them. So it kind of encompassed all of that.
Maybe it's like building prevention spaces or like.
Devin said we could make sure that at least one of our SMART objectives is centered around SUD recovery.
Okay, here's my ask. My ask is that we consider, giving the Community Health Advisory Council the green light to use this draft work plan as a template for our work going forward, knowing that it's something that we have the ability to adjust and adapt along the way. Does this format, these general topic areas, look agreeable to the group so that I can turn around, or we can turn around and go to the Board of Commissioners and say, this is how the Community Health Advisory Council is going to invest their time and energy over the next couple of years. Yes. I don't think I
I don't think I can, right? I don't think I'm allowed to.
You're also an appointed member and Angela is not. Oh, yeah. You could
Work
be.
with this framework all the time in our job, so to me, it makes perfect sense, but if you're seeing it for the first time, it can be a little convoluted, but. I mean, really, yeah, you can adapt it along the way.
Devin said yes. Kimberly said it's hard to hear, so if we could project maybe this way, please. Thank you, Kimberly.
Thank you for reining us in, Kimberly.
Looks like a treatment plan to me.
And Emily had to leave.
All right, so I would entertain a motion regarding this work plan. Can we take the draft off of it and move forward?
Yes.
What does that help?
That was
Oh, Audra, what was that, Audra? You have to say that you make a motion to.
Yes.
Okay.
Is a motion to adopt this draft work plan. Going forward and allowing us to use it to guide our work over until 2029. I'm noting Courtney's feedback about the general format is great, and then having us generalize health and recovery as part of the work, but not all of the work that we do.
Yes.
So I'm hoping that we capture that as if the motion is to adopt this as the template, that gives us the flexibility to add amends.
So if we do want to change something, then maybe go to the commissioners for approval. Like if we change language or.
Or not in the details of it, so from SMART objectives and activities over, no, we have the ability to amend those. It's the focus areas that we've already adopted that are a little more concrete, but if a year from now, something big happens and we need to shift focus, we can do that. We can do that too.
And it looks like Courtney seconded
Okay.
Audra's motion.
If you like to vote in favor of that motion, please raise your hand.
And
April,
everyone.
Hope, and Audra, and online, please put your vote in the chat. If you would like to abstain or vote against the motion, you can do that in the chat as well.
Great, Kimberly and Devin. So I just, even though you seconded Courtney, I still need a yay or a nay or abstain. Who else is on here? Erica, I need to hear from you. Thank you. And I think that's it because Emily left. Otherwise, I think we're right at 7, which is 50%. So.
It feels like we're being productive. We're getting through the like hoop jumping at first to make it all official.
Erica, the motion was to adopt our draft work plan to use as a guide for our work, I think, general speaking.
2026 to 2029.
27 to 30. That's incorrect. I have one that's wrong. Did I not change it on here?
27, 30.
Yep, I wrote that wrong on there.
That's fiscal year 27, correct? So
Yes, fiscal year, starting July 1 of this year.
that's why.
And I got confused when I wrote it out. So yes. All right, we got yays from everyone.
Okay. We will be able to wrap up a little more because our last agenda item is around appointed member engagement, and really that's just an announcement and a brief discussion if we need it around the responsibilities of appointed members. And I don't have our bylaws stuff.
I'll try to pull them.
I would like to offer up that there is language in the bylaws around attendance expectations, and that if we have appointed members who aren't able to attend on a regular cadence, there is a provision that allows members to request that that person be asked, that we ask the commissioners to consider unappointing them and appointing somebody new in their space that can be and engaged. Part of that dynamic, I think, is around scheduling of these meetings. And so I encourage, and I will send this out via email as well, so even folks that aren't here get this, but how important it is that when appointed members aren't able to attend a meeting, that they're communicating with Alex or myself or April, that that's the case, because we might consider having proxies just so that we don't get stuck on any decisions because folks can't be here. And if like the day and the time is what is hanging people up, please communicate that with Alex or myself as well, because we can, obviously it's tough to wrangle as many of us as there are, but we want to be able to make it as accessible as possible for folks to stay engaged. all that being said, I guess I wanna open it up to appointed members if there's things that, if you think that the bylaws are serving us appropriately by requiring, I think, I don't have that in front of me.
It's right here. It
You
doesn't,
have the requirement for the number of meetings that you must attend.
I was just trying to sift through and read it. It just says members are expected to attend all meetings of the council. And then following that, the next line item is by the affirmative vote of at least a majority of its members, the council may recommend to the County Board of Commissioners that a member be removed from the council for continued neglect of duties required by law, for failure to attend council meetings without just cause, for incompetence, or for unprofessional or dishonorable conduct. Such a recommendation shall be made only after a proposed recommendation to the council by the chair or vice chair, or by any 3 members, and after the member being considered for removal has been given the opportunity to appear before the council regarding the proposed recommendations.
So fortunately, that was very heavy-handed.
Yes.
For a reason, because this group can, get into some really important decision-making, and representatives of the group have, sway in those decisions. So our behavior as appointed members is really important. We're not there, like, we're not having issues with this, thankfully. I wanted to just refresh folks that this is the standard that we're held to as appointed members, and draw people's attention to the bylaws, to review them, stay familiar with them. If we need to make amendments to bylaws for things such as a proxy, we can do that. I want to make folks aware that that is an option for us, and in order to move that option forward, it would need to be on an agenda and be a discussion. For now, we are meeting quorum. It tends to be a rotating quorum, which is understandable. So I think I'll emphasize just when you can or cannot make a meeting, be in communication with us about that. Are there any thoughts or comments from the group around that one? I kind of condensed 2 agenda items, but
yeah.
Okay, are there topics for future meetings that you all want to make sure that we consider? I have a question related to that. Are there guest presenters that you think would be, so we can invite people into our meetings to present information. It can be directly related to like activities, or it could be indirectly related, that is fine. But if there are organizations or resources that, if we want COCC to come in and present about their resource mapping, we can make that invitation. It's really broad, but so I'll start asking at the end of each of our meetings if there is an entity that you want us to explore as possible presenters, either formally in an agenda, or we can have them come in to present during public comment. So presenters, are there folks that you want us to work on bringing into this space, and or topics that you want us to address in future meetings?
I think that we're building up our resources and stuff. We know about our resources, right? And how else do you get behind something if you don't know anything about it? So I would like to say that we can have some presenters show up. But that's of course because I already have a couple.
Got some in the field.
We've got Courtney said from our breakout group, it may be helpful to see if the representative from Thrive may be able to come present to collaborate with us.
Thank you.
Yep. And then I'll also say, I know a lot of you already know her, some of you might not, but Caitlin Green from OHSU has been talking with us for six
months now.
months now, trying to get her coworker Paige to come give us a presentation because they're doing work on cancer prevention and I think how it relates to chronic disease. And I think they're trying to gather information for their research side of it. We are planning on having them come in August, I think, unless there's any major people wanting to not do that.
Well, it sounded like we had some backing for that chronic disease space, so that's encouraging.
And then Courtney also added, it would also be great to have someone formally from our health services to understand the services that they are able to bring / missing gaps for care needed in our community. Yes,
So that was Courtney.
that was Courtney.
Courtney, is there anyone specific or a specific health, when you say health services, are you referring to providers in the community?
Sorry, yeah, that was my thought, is because we had a lot of conversations on there, like people having to travel out of town for certain services, but it'd be great to be able to have conversations with our health system players, so St. Charles, Mosaic, Bender, like the people who bring to us, and then what is capable within their sphere to add services, and what do we still find is missing, and then like who do we need to reach out from there? Does that make sense?
Yes. April said she's already got a sheet / template she's working on.
Yeah, April, thank you.
Okay, well, our next meeting is scheduled for June 1st. So we will work on some of this prep. I'll be presenting to the Board of Commissioners prior to June 1st. I'll have an update on how that goes. And we'll start queuing up presenters so that we can start moving forward on our work plan. If you have questions or thoughts or future topics that you want us to include, please reach out to Alex or myself and we'll get that in the queue. And y'all, we're gonna wrap up early today. Please grab some snacks if you're in the room. For everyone, whether you're in the room or on the screen, thank you for joining us. We were hoop jumping today. We were
Thank
doing
you,
the
Kim.
Robert's Rules side of our work, and I think in June we're gonna be able to do a little bit more of that problem solving, fun stuff that we all gravitate towards. I look forward to seeing you then, if I don't see you before.